This video is going to go over our SurgiMat. SurgiMat is our surgical report that is essentially one page that is taped to the furniture, the wall in the surgical operatory. And its purpose, just like with a lot of reports, is to give information about the surgery. And we'll go through each step. The significance of it is that the chair is here, and this is on the wall, and at a glance, at any time during the surgery, you look up, there's a reference to the tools needed, how much bone reduction there is, that type of thing, as opposed to a book to thumb through during surgery. You just simply look up here. It's very clean thing to do and very easy reference. So let's go through from left to right about the SurgiMat and the information that's on it. So we'll start at the left side. There are a couple of important things here. One is patient name, doctor name, so you can be sure you're using the right one. There is some information about extractions, if they're required before pinning, before putting the pin guide in. There may be some extractions which are key. It'll also tell you whether it's going to be long or short drills and fixation pins. Also very important. It'll tell you the guided kit. It'll tell you which implant and which guided kit's going to be used. And then there may be some notes here that are notes taken from the planning session. Sometimes it's implant upsizing, sometimes it's extractions, but key notes that we had takeaways from the meeting that we include before you get started on the surgery, or maybe things during the surgery. We have a section here that is just for the pinning, that has cross sections of the where the pins are going to be placed, so that way you have anatomical landmarks to follow. To make sure that you're not going to obstruct anything when you're placing the drills and pins. And here's a pan, customary view. We have what's called the pin length and occlusal view. So what this does is it helps you during surgery to see that the fixation base is oriented around the bone as it was in the plan. This is floating guide technology. So you'll see a gap between the metal and the bone, and that's what it should look like, exactly like that in the mouth, either before or after all the extractions and the bone is down and reduced. That's a verification. The next one is a bone reduction view. So this would be, as soon as the fixation base is seated, you'll be able to make a visual confirmation of how much bone reduction there's going to be and where the remaining teeth are located. Nice, helpful view. Then there is an osteotomy guide view. This is really just a reference to, again, visually, osteotomy guide is in the mouth. Look up at the osteotomy view just as a quick reference. There is a screw access view. This will show the trajectory of the abutment screws that hold the abutments to the implants, and it will also show in yellow the trajectory of the temp cylinders. And this, along with the view next to it, which is called the carrier guide view, help to make sure abutments are oriented properly. It'll also tell you confirmation that the implants are rotated properly, because the temp cylinders will be in the proper position as planned. That's a confirmation. So if there is something that is different in the mouth than the carrier guide view, then you know that either an implant is rotated or perhaps an abutment is in the wrong index. That'll help make sure that the conversion goes smoothly and that everything is in its right place. Then we'll come back over here to the left, and we will have what's called a drilling protocol right next to the slices that show the implant in relation to bone reduction and in relation to the bone. So you can see the positioning of the implant for confirmation. That has the implant number. It also has the angle of the multi-unit abutment. You know, in that case, you'll see a 30 and a 0 degree in the first one. It will also have anatomical features as a nice reference when you're drilling your osteotomies. The drilling sequence as mentioned. And then we also have this convenient place to keep track of torque values. Torque value of the implant, of the abutment, and then the collar height. Because sometimes things change in surgery. The abutment selected may not be the abutment chosen or actually used, or the collar height might have changed based on tissue thickness. So it's a nice reference, and of course, always want to keep track of torque. When you've completed all of these sections, you can take a photograph of it and put it in the patient's record. or you can even email it to us. We'll keep it as a record for you, as a permanent record in the case. So that's the SurgiMat. Those are all the informational items about the surgery itself. We do have a QR code here on the end that just helps as a reference for torque values. We have a web page that you can just select your implant and it will tell you the torque values of any of the prosthetic components. Along with the SurgiMat, which goes on the wall, is the SurgiMat that goes on the counter. And these two work together, but the information on here gives the team a location to place a component on the table. So as opposed to just having a big box or a surgical cloth with a bunch of marks on it, this allows the team to organize their components. This is the implant is here. This is a size, 5x8, with for number 30. Place that there. This would have the multi-unit abutment position, and then 2 temp cylinders, because you always have 2 for chrome. So you would organize all your components, left to right, and you would place them on the table, and everything is organized that morning or the night before, ready for surgery. So that is our SurgiMat, and we will always take any questions about this or more detail. Just let us know. Give us a call.